Good afternoon, everybody, and welcome to the webinar on the IHI Call 7, Topic 2, User-Centric Technologies and Optimized Hospital Workflows for a Sustainable Healthcare Workforce. I'm Nassima. I will be your moderator for today. And before we start, I just want to give you some information. So we are recording this webinar, and it will be published on the IHI website and the B2Match platform. We will also share the presentation slides. The call will be officially launched next week, and all the links and details of how to apply will be published on the IHI website and the Funding and Tenders portal. I'm here with my colleague, Manuel de la Guia Solat, who is the Scientific Project Officer for this topic. And we also have in the room our colleagues from the legal team, Domenico Lali, who are there to answer the question. Important question, you can send them to us anytime via the chat. Just send them and we will get them at the end of the presentation. Now I will hand over to Manuel for the presentation.
Thank you, Nassim. I hope you can hear me. Let me just get me set up. So welcome indeed to this session, this webinar for Call 7, Topic 2 of IHI. First of all, let me just explain what we are going to cover in this session and we're not going to cover. What we will cover, it's an introduction to the IHI program, the Innovative Health Initiative program. We'll talk about the topic, we'll talk about the challenge that we are addressing, we'll talk about the need for a public-private collaborative research. We'll also go through the scope, define the outcomes and the impacts that we do expect from this topic, and also the budget that is allocated to it. We'll give a brief hint about proposal submission, we'll talk about evaluation, and we'll finish with some preparation tips. What we are not going to cover through the session are the rules and procedures for participation and how to prepare the financial part of the proposal. There's going to be separate or independent webinars for these topics. I encourage you to check the agendas and get tuned for tomorrow and the day after for those specific webinars. I'll be reminding this again and again through my session. So first, we're going to start with the Innovative Health Initiative, a description. What is it? So IHI, as we call it, is a partnership in health between the European Union, which is represented by the European Commission, and the healthcare industry associations. So we're including here COSIR, FPA, including Vaccines Europe, Europa Bio, and MedTech Europe. Altogether, they represent a huge range of health-related industry, from medical imaging, radiotherapy, to vaccines, pharmaceutical in general, biotechnology, and medical technology industries. So the general objectives of IHI are three. So turn health research and innovation into real benefits for patients and also for society, to deliver safe and effective health innovations that cover the entire spectrum of care, from prevention to diagnosis and treatment, and particularly in areas where there is an unmet public health need. We're also supporting the European health industries to continue to be globally competitive. So our main tool of working are projects, and you have to take into consideration that IHI projects are created via open and competitive calls for proposals, like the one that you're attending a webinar for. And projects within IHI are cross-sectorial public-private partnerships. They're leveraging contributions from two different sources, the private and the public. So on the private side, we have contributions from industrial partners, from the IHI industry associations that we just described some seconds ago, and if relevant, also contributions from other contributing partners. Note, these contributing partners must be approved by the governing board of IHI. From the public side, IHI is making use of public funding via the European Commission within the frame of Horizon Europe. The main focus of IHI lays in cross-sectoral approaches to facilitate the creation of new products and services to prevent, intercept, diagnose, treat and manage diseases, and foster recovery more efficiently. Our main goal is to lay the foundations for the development of safer and more effective healthcare products or solutions that respond to unmet public health needs and that can be implemented into healthcare systems. It's worth reminding that the research supported by IHI should remain at pre-competitive level at all stages. And this information and further details about IHI objectives, functioning, and vision can be found in our scientific and research innovation agenda, which can be accessed via the link that you can see at the bottom of your screen. As previously indicated, IHI works mainly through the funding of projects. In this case, I'm going to present the single stage procedure because we have two different procedures, single stage and two stage. Take that into account if you're attending webinars for call 7 and call 6. In this case, call 7 being a single stage is more straightforward. We will launch the call. It's imminent in the coming days, and that will open a frame for consortia, applicant consortia to form, to get finished, to take form, and to write their proposals. Take into account that those consortia can include private partners, academics, SMEs, regulators. So there is a broad variety of institutions that can join those consortia, and they will have to come up with a proposal that will be submitted to IHI. By the deadline, the time of the deadline, we will proceed with the evaluation. It's a competitive evaluation. We take on board independent experts that help us with the evaluation. They will evaluate your proposals and they will generate a ranking, and the proposals on top of those rankings, as long as they go over a certain threshold that we will discuss in the coming slides, they will be invited for signing a grant agreement, depending on the budget that those proposals are requesting and the project that is available for the topic. Those proposals that are successful will become projects after preparing a grant agreement with IHI, and the project will continue to be monitored during its implementation by IHI. So we're going to go into the specifics of the topic. As said, call 7, topic 2. The title being user-centric technologies and optimized hospital workflows for a sustainable healthcare workforce, which can be a bit of a mouthful, but it faces a challenge that is probably quite obvious for the audience attending today. And it's the fact that healthcare professionals face increasing workloads and pressure that results in an increase in burnout, stress, and related work absences. That has an impact not only on the staff itself, but also can have an impact on the patient care and the health systems. There's a variety of technical solutions that have a potential to support the healthcare workforce, but their adoption has faced many challenges. So examples could be automation, data analytics, or artificial intelligence. And as many of you would know, they are facing challenges in different areas, such as integration or training or validation of the systems. And that's partly because those systems require for user-centric and intuitive solutions to ensure proper integration, and also to collaborative design approaches to make sure that adoption is guaranteed by the final user. This challenge being quite broad, so the main challenge of human technology interaction and also integration on workflows has been already addressed by other programs in a broad manner, but IHI is best suited to address the specific needs of the healthcare sector. We're convinced of that because actions funded within this topic will need to apply cross-sectoral approaches involving the medtech and pharmaceutical industries for the effective integration of these new technologies in the clinical workflow. They will need to bring together a broad amount of user groups involving all relevant stakeholders within the healthcare domain and also the industry partners to ensure that all the inputs are integrated from the beginning. And also there's a multidisciplinary approach that is going to be needed to enable an objective and qualified evaluation of the proposed technologies and also to ensure the user acceptance of those proposed solutions. So we're going to describe now the scope of the topic. We have 3 slides for this. So activities within this topic must focus on the development and the implementation of solutions to empower the healthcare workforce without adding extra burdens to the medical staff or to the health staff. And we have a broad scope for this type of for the type of applications that we're considering. Can come from diagnostics and intervention to the actual management and organization of hospitals and medical institutions. Activities must propose solutions to automate the workflows, to adopt and integrate new capacities, and also to develop autonomous technologies or technology experiences. These solutions should be data-driven, should improve workflows, assist clinical procedures, and support efficient healthcare resource consumption. And also consortia should take into account standardized data acquisition approaches to ensure proper technology development and also training. Again, consortia with their proposals should propose and implement better integration of existing or emerging technologies or a combination of both in different workflows within the hospital setting. They should demonstrate potential for deployment through use cases addressing wider staff categories. And here we include from nurses to medical staff, specialists, manager, etc. They should also establish effective training approaches for complex technologies, ensuring that training is effective and is not causing an extra burden on the staff. To demonstrate scalability and transferability across healthcare professions and different levels of care, and also demonstrate that the solutions are feasible from an economic perspective. And this can include different angles from healthcare institutions to payers, insurers, or healthcare systems. So wherever relevant, the proposed solutions should also aim at developing and applying standards that are relevant to the proposed solutions, ensuring the potential for regulatory approval, taking into consideration the different national regulatory requirements to ensure future implementation in the target markets. Because in the end, what we want is to make an impact. What we want is these solutions to be implemented in different markets. Also take into account other possible dimensions with regulatory implications, and consider supporting the secondary use of generated data, in particular for research purposes. Last but not least, projects are expected to learn from other EU-funded projects that could be past projects or could be also running projects, find synergies, try not to compete or reinvent the wheel, but try to come together with common solutions, and in that way find an optimized solutions. So while this is the scope of the topic, also the topic defines several outcomes. In particular, for this topic, we listed 4 outcomes. Just take into account that what we expect is the actions to contribute to at least 3 of them. So as long as you are contributing to 3 of them is fine. You can indeed address the 4 of them if that's in the scope of your proposal. As you may know or may not, that's why I'm going to repeat the definition. Outcomes refer to short-term benefit that happen after the project results. So first we have the results, and then from those results we will have in the short term the outcomes. So what outcomes are we expecting from projects funded in this topic? So first one is for the healthcare professionals that will benefit from assistive technologies that are user-centric and also improve hospital workflows. This should result in optimized procedures, new capacities, and will improve workload and job satisfaction for those professionals. Regarding the patients, they will also benefit from an improved experience throughout their entire care journey, and also enhance healthcare services. Regarding the European healthcare systems, they will benefit from increased functionalities and new and better capacities. And last, healthcare providers will benefit from improved workflows and cost effectiveness and efficiency, and also a better experience of both hospital staff and patients. If we're thinking long term, then we go into the impacts for this topic. We've listed 5 of them. The first one is about the sustainability of careers in healthcare. So to the development of innovative technology should contribute to halting the current influx of medical professionals. We also expect an impact in improving the patient care by making use of advanced diagnostic and treatment technologies, more efficient clinical workflows, while at the same time ensuring privacy and security of patient data. So companies should be able to develop technological solutions to support healthcare professionals, considering workflow integration and also reflecting on the needs of the end user. Healthcare systems will improve their capacity and resilience because of more efficient and sustainable solutions. And also there will be an impact on different European Commission initiatives. In particular, we're thinking of the comprehensive approach to mental health and the initiative A Europe Fit for the Digital Age. That's part of the end in the description of the topic. We're finishing with the impact, and it's linked to the impact. It's very important to always take into account dissemination, exploitation, and communication of the project, because in order to maximize the impact of the project, it's very important to ensure that end users within the consortium and out of the consortium are going to be able to benefit from project results. They're going to pick them up, they're going to continue with the work, they're going to continue with the research, and we're all going to keep on benefiting from those outcomes, from those impacts. Dissemination, exploitation, and communication are critical to maximize the impact defined for your actions. So you have to take them really on board when you're defining your proposal. Make sure that you reserve some budget for effective dissemination, exploitation, and communication of your results to general public, to the scientific community, and to basically to any institution and public that could be interested in the results of your project. Describe the dissemination, exploitation, and communication measures that are planned and the target groups addressed, in particular, encouraging the uptake of the results of the project through a strong communication and outreach plan, and allocating appropriate resources to explore synergies with other relevant initiatives and projects, as we already mentioned. Just take into account that the 3A provisions, availability, accessibility, and affordability, do apply to this topic when preparing your dissemination, exploitation, and communication plans, but also when preparing your proposal in general. So my next slide is going to present the budget. Yes, I will need to check there. We need to look on the side a little bit. So we have a total available funding for this topic at IHI of 25 million euro. So that is the total amount of funding that is coming from IHI into the projects that are going to be funded under this topic. So that's what we know for sure. And now we're going to give you an example, which is an estimation by IHI on how big a project should be roughly to tackle the topic. So we consider that contribution from IHI of 12.5 million should be enough. It's a ballpark figure, but should be enough to address this topic. That would mean that this 12.5 million will be compensated or will be matched by industry or industry and contributing partners with another 12.5 million. Because as you may know, otherwise I insist, please do register for our financial webinar. At least 45% of the project budget must be covered by contributions from other participants. So we're aiming at a 50-50 contribution. That would be 50% IHI, 50% industry. If this was the case for a project, 12.5 million from IHI, 12.5 million from industry, the total budget, the total cost for this project would be 25 million. With the 25 million of IHI, we should be then aiming at funding 2 projects. But this, because each project will receive 12.5 million from IHI contribution. This is just an estimation, and we understand that depending on the construction of your consortium, this financial contribution from IHI and this contribution from industry will change. Since our budgets are quite complex, quite complicated, I'm presenting here a simplified budget example. Again, for more complex cases, we invite you to go to attend the training on financial aspects of the IHI projects. In this case, this simplified case has 3 rows. The first one is the public partners. So this project will have a total set of costs of 40 million. And we see on the first row, public partners with a cost of with a total cost of 15 million. So they are claiming these 15 million from IHI funds. On the second row, we would have the private members and contributing partners that are not requesting anything from IHI, any public funds, but they are contributing with another 15 million. So that's kind of setting an equilibrium, 15 on one side, 15 on the other one. But we can also have some hybrid members, and that could be private members and contributing partners that are having a total cost of 10 million, and they may be requesting 5, but also providing 5. So that's another possibility for an institution to come in with some funding, but also request part of the costs. In total, we would get 20 million of reimbursed costs, 20 million of contributions, 50-50. We're safe. For more details, join my financial colleagues on their webinar. So we will go next and talk about proposal submission and evaluation. So that's what is going to come in a few days when you will be able to prepare and submit your proposal. The proposals for IHI, we divide them in 3 different parts. Part A is the administrative data. It's entered in web forms through the Funding and Tenders portal, and it also includes data from research staff within the consortium organizations. Second part, so it's part A, part B, and the annexes. Second part, part B, is the heaviest part. We call it the narrative part, and it needs to be uploaded in the portal. So it's written, you need to fill in a doc file, and then it will be you will need to upload it in the system. It includes 3 sections, 3 sections being excellence, impact, and quality and efficiency of the implementation. We call them excellence, impact, and implementation. Just remember those 3 words because they are coming in the next slides. Read the instructions very carefully. There is a proposal template for this part B. So just do not deviate from it without any justification. Just stick to it, because these 3 words that I just mentioned, they're also used for the evaluation. We'll go and make the comparison now. So if you follow the template, you can help your proposal to be more complete, but also you can help your proposal to be more reviewer friendly. And reviewers are human beings. So if you make their work easier, it's easier for them to find the value in your proposal. The last part, apart from part A and part B, are the annexes. I'm not going to describe them because there's several of them, and they apply or not depending on your proposal. Please do consult the guide for applicants for more description on them. Very much linked to the proposal template. On this next slide and this slide and the next slide, we're going to talk about the evaluation criteria. There is a lot of text in my slide, so we're not going to go into the detail. We're not going to read them one by one. We're going to leave them here for your consultation. But there are a few points that are worth highlighting. Just remember, I said that IHI makes use of external experts. They are independent. They are checked for conflict of interest. And those experts, they are instructed to stick to these evaluation criteria. So it's very important that you understand them. It's very important that you know them and that you understand what you've been asked and that you cover them when you're preparing your proposal. The evaluation of your proposal and its score will depend on that. So they do follow the same structure as the part B: excellence, impact, and implementation. I will show this on my next slide. So again, we can only recommend you to follow the template as much as possible. As just shown, there are 3 evaluation criteria. Each of them has a threshold. They are scored equally up to 5. So you will need to reach a threshold of 3 out of 5 for each of them. Overall threshold of 10 out of 15. That's quite demanding, just to make sure that only high quality proposals are eligible for funding. So my last part of this presentation today are a few tips for the applicants. As said, it should be crystal clear by now, but read all the call relevant material, especially the topic text, but also all the information you have on our website, the guide for applicants in particular. Follow the templates. Form your consortium early. So we didn't open the call yet, but it's already a good moment to start talking about it. Think about public-private partnership, because it's only through cross-sectorality that your consortium will be able to reach further and also to cover all that is demanded, that we know it's a lot in the topic text. And just remember that being a single stage call, you need to include partners bringing the in-kind contribution in order for your consortium and your proposal to be eligible. So make sure that all information requested in the call text and the proposal template is provided to allow the evaluation experts to easily assess your proposal against evaluation criteria. Just consider and plan for the potential regulatory impact of results, including potential taking on board stakeholders that can support you to do so. And once again, do watch rules and procedures and financial aspects, the webinars that are coming in the next 2 days, and also feel free to follow the webinars on the other topics, even if they may or may not be of your interest, because my colleagues can also give you insights that I may have missed during my presentation. Regarding finding your partners for your consortium, we know it's a difficult task, but it's a critical aspect, because only through a good consortium you'll be able to put together a strong proposal. So we try to help on this topic as much as possible. Try to network, try to begin with your contacts and also the participants of the IHI Call Days, because there are reasons to assume that they are interested also in this topic. So we have the links here. Use the EU Funding and Tenders portal. There is a tool for partner search. Also, the link is included. Get in touch with your IHI national contact point. You have a link to the list. These are extremely knowledgeable people. They should be able to put you in contact with other institutions or to just set you in the right direction. And also feel free to use social media to network through any kind of social media, your own or also IHI's. We try to be quite active on social media. You have our links in there. Feel free to reach out and to use our channels in order to get partners for your consortium. That being my last slide, I give you, Nassima, the floor again. Thank you.
Thank you, Manuel, for this presentation. So before we go to the question session, we would like to promote the session that we are holding on call 6 and 7. So if you haven't joined already this session, please do so. So by going in your profile in the B2Match platform, you can add the session that you are interested in. So you can see that we have an ongoing session for the 3 coming weeks. Also, there is pitching session on the call 7. So we want to focus on them. And if you want to pitch, here is the instruction. So you have to indicate this in your profile by Friday. You have to register for the pitching session for your topic, create, of course, a participant profile and a marketplace, and download the slide template and send us your presentation by the 19th of January. Now we will go to the question session. I can see that we already have 2 questions in. So the first one is Sanya asking, could you please elaborate a bit what does the contribution to comprehensive view on mental health refer to?
So I was unmuting myself. So for this question, I assume you are referring to the to our slide in the contribution to. We're talking about impact, the comprehensive approach to mental health. If that's the case, well, it's a bit difficult to condensate it here, because it can be done in many different ways. But if you read, if you can have a look at that initiative from the European Commission, you will see that mental health of medical staff will will align quite directly with the focus of these, with the scope of this topic. So it's almost natural that almost all proposals that we're going to receive will be supporting the mental health of the medical staff and will be fitting with that initiative of the European Commission.
Thank you, Manuel. So the second question is from Gabriela. Where can we find the template for the narrative part?
Yeah, sorry, we're just aligning because we are on the verge of opening the call. If you go to our website, you can find in the apply for funding, you can find a proposal template part B for the previous calls, for call 5, call 6, stage 2, and call 7. It's already here. So it's been already uploaded. What I would do is I would take this document and I would make sure that once the call is launched, I would just double check that that is stable, should be the same, but wait for the document downloading until the call is open, because then you know that everything is stable. But you can find the document already there and also compare it to the previous calls 4 and 5.
Thank you. The next question is from Nicola, and he's asking how many projects will be funded by this topic.
Yeah, it's a bit difficult to say because it will depend on the projects themselves. So as stated, we have a total funding for the topic of 25 million. So it will depend. If we receive smaller projects that are ranked the highest in the list, that could happen. The numbers will be different too if we receive larger projects that are scored the highest in the ranking. So we are assuming, or we are thinking that this 12.5 million would pretty much do for the type of project that is described by the scope. In that case, would be about 2 projects. But if it's going to be 1 or it's going to be 3, we are still not sure about that. Will depend actually on you.
Thank you, Manuel. The next one is again Gabriela asking, if we register on the pitching session, can we just listen and observe the session? Of course, you can definitely observe and listen to the session, and you will be listening to the pitchers depending on the topic that you are interested in. But I invite you to do so. So you go on the B2Match platform on your profile, and you add the session that you are interested in. It's on the 23rd, 24th, and 25th of January in the agenda. We can go to the next one. It's Anna Elisabetta asking, is there a minimum amount of money you might ask for funding?
Yeah, there is no hard limit on the minimum amount of money. It just needs to be in line with the amount of tasks that an institution is going to take over or is going to implement in the project. So depending on the tasks that are going to be implemented, the funding should be according to that.
Okay, thank you. The next one is from Francisco, asking, is there a list of companies that will be expected to be part of the project, many in-kind contribution, and so on?
No, there is no list of companies that will be expected to be part of the project. It's now up to the different institutions, companies, and also from the public sector to network and to connect and to try and find the consortia. But this is one of the differences with a 2-stage call, that there is a pre-identified consortium. Here, there's no pre-identified, and all the consortia will start from scratch, or should start from scratch, and will assemble themselves, prepare a proposal, and compete on an equal competition. So there is nothing predefined.
Okay, Next one is from Raquel. Until what time is the registration to the pitching session? It includes all day of the 12th January, of course, yes. So you have till Friday, end of day to register. So either you register to pitch or to attend, up to you. But yes, you have till Friday, end of day to be with us. And the next one is from Sergio. Is there an expectation that SME's large contribution to the technology solution for optimized hospital workflows? If so, what would be the interest from the large industry players to co-fund the project?
Okay, I'm coming. It's a long question. Sorry, I had to reread it again. It's maybe a vengeance for the title of the topic. An expectation that SMEs large contributions. There is no real expectation for SMEs to make a large or small contribution. We do have projects that have been funded through single stage calls where an SME is taking actually the technical lead of the project. We have other projects where there are like larger companies and they have SMEs embedded also in the project, taking smaller parts of the project. And what we see is that normally when these consortia are put together, there are many benefits for all the players. Well, from a point of view, there is public funding also matching the private contribution, so that's an incentive already. But there's also an ecosystem that is formed with also with universities, regulators, and so on that gives a special type of collaboration. So it's not just about big and small companies. I may have missed the question a little bit, but what we see is that usually small companies benefit from interacting with large companies. Large companies, they usually also have a benefit from collaborating with the smaller companies and with the public sector.
Thank you. Next one is from Anna-Elisabetta. Is there the possibility to listen the recorded file of this session and even for the others of tomorrow? Of course. So as we said at the beginning, all the recording and the slides will be shared on the IHI website and the B2Match platform. So today we will publish the two sessions that we had today, and we will publish the other ones following the day. And we have another one from Dominique. How many partners do you usually see within successful application for consortia in a one-stage call? This one is for Domenico.
Good afternoon, everyone. So normally proposals are assessed and are competitive by nature, so we do not have in mind any fixed number for consortium composition for 5, 10, 15 or any other number. It depends from the activities to be performed from the consortium and from the representation of the in the consortium itself. There is, however, a minimum of 3 legal entities from at least 3 member states or 1 associated countries to the Horizon Europe program to participate.
Thank you, Domenico. We have one other question coming in from Johan. Will contributing partners attend the pitching session? In our case, there is a system that ticks almost all boxes, but we lack a contributing partners. Can you address this one, Domenico or Manuel?
Yeah, there is a small concern from my side on this question, because there may be a confusion with the term contributing partner. You need partners that are bringing in in-kind contribution to match the public funds. So that's one thing, but just be careful with the contributing partner description, because it's a very special legal term. So you don't need a contributing partner. You need partners that are bringing in the in-kind contribution. I guess that's what you were referring to. On who is attending the pitching sessions, I'm not sure if we have figures on the audiences or on the registrations.
You can find the potential speakers on the platform. So if you go to the topic session, you click on the speakers, and then you can see who wanted to pitch on the topic itself. But the official order of appearance will be shared by next week to all the potential speakers. But yes, I mean, it's we have a lot of different partners that wants to pitch, but it will be officially shared next week. And then we have a question from Nicola. How long is the project expected to last?
Yeah, I'm afraid we have to give you an evasive answer here because it's not really defined. We are giving us an estimation for the budget, but we are not giving an estimation for the duration. So it really needs to be considered within the consortium when preparing the proposal, how much time you need to be realistic to define and implement your action, taking into account all the activities that you are going to be putting together. But we are not giving an envelope or a fixed amount of months that we need for the implementation of the project.
Thank you, Manuel. And we have another question in. Let me just take it from Crystal Liffer. I hope I pronounced it well. Are you in the position to be able to answer a very high level question of the overall goal and effectiveness of this proposal and the likelihood that the outcome will not be counterproductive?
Well, I don't know if I'm in the position because I don't know the question. I'm certainly curious.
Thank you. I don't see any new question in. So meanwhile, I encourage you to drop your question on the chat box. I wanted to in phase and take advantage of showing you how to make the most of the platform. So if you want to find partners to create consortia, just navigate to the platform, go to the marketplace on the main menu tab, select the project cooperation and select the topic that you are interested in. And then you can browse to the project IDs and contact the owner of the project directly via the platform. Also, it's good to have a reminder on how to book your meetings via the B2Match platform. There is four easy steps. First, you need to make yourself available. Look for partners on the participant tab as a second step. Then when you find potential partners, select a date, a time, and the attendees. You can be up to 8 per meeting, and you can send them messages and then send the meeting request and wait for their reply. So we really encourage you to use the platform as it's the only spot to be able to meet partners and build the consortia. I don't know if we have any other new questions in. No, I don't see any other one. So yeah, I think that we can close here. So I just want to thank you, Manuel and Domenico, for their presentation and replying to the question. Thank you all for your interest in the IHI and in this topic. I of course wish you a good luck with your proposal, and if you have any questions, please address them to the info desk email box. Yeah, we can close it here. Thank you, everybody. Bye-bye.